Today's program is Shop Safe and Eat Safe, Tips for Staying Healthy During COVID-19. And today's presenters are MSU Extension faculty members and our food and nutrition specialists, Brianna Routh and Carrie Ashe. Please take it away.
Thank you. We're really happy to be here today. As Caitlin said, my name is Brianna Routh, and here with me today is Carrie Ashe. If you want to say hi, Carrie.
Good afternoon, everyone.
We're really excited to have this opportunity to share with you and hopefully answer some questions that have come up as we are in a new and emerging time with COVID-19. And we also want to know that you may have questions too. So if you do, feel free to write them in the chat box and we will be checking that and save a little bit of time at the end to try to answer some of your questions. If for any reason we don't get to them all, we will, as Caitlin mentioned, try to get some responses for you and post them too. But again, so today we're going to be talking a little bit about how to shop safe and generally eat safe and protect yourself as well as your community when thinking about this new virus that we're dealing with. So make sure that my slides move. There we go. So again, today we're going to talk about, can you get COVID-19 from food? Let's start off with the basics. We're also going to think some about the basics of safety practices and food safety practices, thinking a little bit about takeout food and is that safe, as well as how do I stay safe at the grocery store and what should I do with food once I bring it home. We will also address a few of the common myths that are going around right now about COVID-19 and food, and again, try to answer some of those questions that you might have. So again, starting out with this basics, can I get sick from COVID-19 from the food that I eat? So currently the FDA, USDA, and CDC are all in agreement that there is no evidence at this time that we know of that there's transmission of the COVID-19 disease through food or food packaging. They also are assuring us that the US food supply is safe for both people and animals. We also know that fresh produce, which is a common thing people are concerned about at the moment, that is still safe to eat. We do know that there are no food or supplements based on research that we have currently that can cure or treat COVID-19, but we do know that if you try some of these, they may in fact be dangerous. So again, food and food packaging itself, there's no evidence at this time that that may be a transmitter of this virus. Again, this is an emerging issue. If something does change, these would be the three sources that would be telling us if something did change, but at this time, it does not appear that that is the case. So what are those basic safety practices that we want to keep in mind as we're thinking about COVID-19 or any other illness that we might have in general? First and foremost, we want to wash our hands. That is our biggest protector at this time, especially thinking about food-related challenges, washing our hands. This means getting your hands wet, washing them, lathering them with soap for 20 seconds, and then rinsing that all off. It seems like a long time, especially if you haven't been counting to 20 or singing happy birthday, but it is the best way that we know of to get rid of that virus from your hands. Also, if you do have a cough, we want to try to cough into our elbows or cough away from other people as well. And our face is also an important thing when thinking about this virus. One of the ways that we often would get this would be by touching our face, our mouth, our nose, and sometimes our eyes. And so the CDC has come out with recent guidance that says it's a good idea to wear face masks, generally cloth face masks, as we're trying to save some of those medical grade masks for healthcare providers and first responders. But they do recommend wearing face masks in times when you're in a social, when you might be near someone in something like a grocery store in a social setting. So we also want to try to keep space and keep that distance from other people. That means at least 6 feet, more if you can manage it. And generally, as I'm sure many of you are joining us from home right now, there are strong recommendations that we do stay home as much as you can. That's again to keep your distance, to keep both you safe and the community safe. So what about when we're thinking about food safety practices? Well, if you're familiar with general food safety, those same guidelines are still applying right now. That includes that we do want to wash our hands both before we're preparing food, during food preparation, if you're changing activities, as well as before you eat. And that will, again, reduce the risk of foodborne illness, as well as potential transfer of the COVID virus. We also do not want to wash our produce, that fresh produce again. We don't want to wash that with soap or any sort of bleach substance. Just generally washing with water is the best way to clean produce. And that still remains the best way to clean produce, even in light of this virus. We also do regularly want to clean our kitchen surfaces. This includes both cleaning to wipe off larger particles that may be present, but also disinfecting. And again, you want to follow manufacturer recommendations. The EPA has a list of disinfectants that are approved to both kill the COVID virus, but also safe to use in kitchen situations. So check that out, but also do generally try to keep your kitchen surfaces and eating utensils, for example, as clean as possible. You also want to cook food, again, to the recommended temperatures and refrigerate promptly. So keep those hot foods hot and cold foods cold in order to keep that food safety. And so we're going to talk a little bit more about some of the specifics around other ways that you might be getting food or preparing food as well. And one of those is takeout food. So big question right now with a lot of restaurants being closed down or only having that takeout delivery option available. People want to know, is that safe? Can we still eat those foods? And as far as the guidance currently is, that is a safe way to eat foods, and sometimes that's even safer than other options like actually dining in a restaurant might be. We know that commercial food producers have to follow best safety practices in order to reduce that risk. So for those of you out there, I know a number of you on this chat might be familiar with something like Serve Safe. Those similar principles will still apply to food producers. Things like wearing reusable gloves, washing hands on a regular basis, not coming into work if they're sick still apply for those restaurant settings. So they are using best practices. And there's no current indication that takeout or drive-through foods and meals will increase your risk of getting sick at this time. They may, in fact, again, be somewhat safer because they do allow you to maintain social distancing or that distance between people that you might have to interact with. And it's best if you can get food from places that would require no touch or no interaction because that has even lower risk. So this might be someone leaving a food outside of your door, for example, if they're delivering, and then you picking it up after they leave or after they have set the food down. This also is potentially helped by paying in advance, whether that's online or over the phone. And restaurants, even though this may be a new policy for them, a lot of them are posting this on things like social media or their websites, but you can also call to ask if these are possibilities too. And again, thinking back to our food safety principles, we want to keep those hot foods hot and those cold foods cold as quickly as possible to, again, ensure that that food is safe. And so now I'm going to pass it over to Carrie to talk to you a little bit about grocery stores.
Thanks, Brianna. One of the places we all probably have to go at this point and aren't too excited to go might be the grocery store. Groceries are essential during our stay-at-home order. And so I wanted to talk through some tips and ideas for grocery shopping. And so first and foremost, I would just say if you're considered a high-risk group, and the CDC, of course, has named who those groups are, and it's possible to have a family member or neighbor do your shopping or do the call ahead grocery pickup, which some stores do, that would be your best bet at this time. If you're in a high-risk group, is to not go to the grocery store at all. But for many of us not falling into that group or not having that option, we do need to get to the grocery store. So consider looking for the least busy times at your grocery store. Perhaps that's early morning and perhaps that's late at night. Looking for special hours for those who might qualify for those. So those high-risk folks, sometimes grocery stores say, hey, from 7 to 9, you can shop without everyone else. So that's a good thing to look for at this time. Ideally, you would go to the grocery store less. So make yourself a list for a couple of weeks worth of food, and it helps to plan your meals. Really write that list, look what you have on hand, and then choose some less perishable options as well. So perhaps you go through all of your fresh produce in the first couple of weeks and you move to canned or frozen for a week or two after that. Both are nutritious, safe, and healthy options. When you get to the grocery store, many stores provide the service of having disinfecting wipes available, which is a great thing to grab and wipe down that cart, wipe down anything that you're going to touch on that cart, so that you start with a clean cart. If your store, if you know they don't have those wipes, but you have some, it might be a good idea to bring one in with you and do that wipe to start you. As you move throughout the store, of course, you're going to be social distancing as best you can. We'll get to that a little later, but avoid touching your face. So you're touching things in the store. It's a good idea not to touch your face because that is a transmission method when you touch your mouth or your nose, possibly your eyes. So don't touch your face while you're in the store. If you have a little hand sanitizer bottle, sanitize your hands frequently throughout your visit. Or if the store provides some, it's a good option to use some of theirs. And certainly do that before you get back in your car. Another thing you could do is do another wipe before you get back in your car. If it's possible, use the self-checkout. Again, of course, you're going to be touching things there, but you won't be face-to-face with a clerk or an attendant, and you can maintain that social distance a little bit better at that self-checkout. Ways to keep others safe while you're there as well. Certainly if you're feeling ill, it's not the time to go to the store. Maybe someone else can go for you, another household member, or again, a neighbor. Don't touch everything. That's good practice anyway, but just touch the things that you're going to buy, so that the only things you're touching are the things going in your cart. Of course, I'm sure we've all heard social distancing a million times now, but maintain that social distance as best you can. Try not to get too close to anyone in the store, and shop alone if you can. You know, if you've got kids at home, it wouldn't be the time to bring them to the store. Some brand new guidance, and as Brianna said, this is an emerging and changing situation. So if we would have presented this a week and a half ago, this wouldn't have been mentioned, but we did have some change in guidance, and now the CDC does recommend that when you go to places that it would be difficult to maintain your social distance, such as the grocery store, that you should wear a mask, preferably a cloth one, again, saving those medical grade masks for our healthcare providers. Certainly be sure not to touch your eyes, nose, and mouth when you're removing your face covering. Cloth masks should be washed after each use, and then immediately wash your hands after you remove. And the CDC website for coronavirus has some great resources on how to put on and take off a mask that are really easy to check out for the general public. Now, once you get the food home, this one, depending on what you read in the media or on social media, you might see many different suggestions for what you should do when you bring food home. First and foremost, you should wash your hands with soap and water, both when you get home and once the food is put away. Again, 20 seconds, hot water, soap, scrubbing, not the quick rinse. The big question most people have is, should I wipe down those food items? Well, if you go and look online, you can find doctors who say both ways. So just because it says doctor, you know, certainly we can take that to heart a little bit, but at the same time, the experts are really saying that no, you don't have to, but you certainly can. And I want to go through some guidelines because this is one of those sort of gray areas that people are questioning. So again, as Brianna said, there are no known cases of coronavirus from food or food packages. Okay, so that should give us, that should help calm us a little bit. However, it is known that the virus can live on plastic and stainless steel for multiple days and on cardboard for 24 hours. Although that is the case, the primary transmission of the virus is person to person, not cereal box to person, for example. So some folks have been suggesting that you can wipe down non-porous containers, but you of course should follow the directions on the disinfectant that you're using. So does it hurt you to wipe down your soup can with an appropriate disinfectant? No. Could it make you safer? Perhaps. Do you have to do that? No. The CDC and other governing bodies say you do not have to, you can. Now, I would say be very careful with the use of chemical disinfectants on things that are porous. So you would not want the chemical disinfectant on your fresh produce or seeping through holes in, say, a strawberry container. And so please be very careful of chemical disinfectants, as these really can cause illness if we accidentally consume them. So to reinforce what Brianna said, do not use those disinfectants on fresh produce, only clean that with water, and think about your packaging as you bring it home. Also think about, let's just say that you wipe down a bag with some bread in it, and it gets nice and wet with disinfectant, and then you have that on your hands and you go eat something. Please keep in mind that those disinfectants, you would want to wash your hands thoroughly after using them and not be reaching into your food to grab something out. Again, just to wrap up what you should do when you bring that food home, you of course should clean those kitchen surfaces frequently. Consider those plastic bags you may have brought into the house or paper bags. Throw away or recycle the non-usable bags, but I wouldn't go to use them again right away for some other purpose. If you are using reusable bags or a cloth mask, you should wash them after you get back from the store after every use. Again, after you've put your groceries away, wash your hands with soap and water, following those good hand washing guidelines. And then, as Brianna covered earlier, follow all food safety guidelines when preparing your food to eat.
Thanks, Carrie. So as you've heard, we've mentioned many times this idea of washing your hands. You'll find that that is actually the most recommended way to reduce any risk or limit any risk of getting this virus when you potentially are interacting with food. We don't think that if you eat something that has a virus on it, that is going to cause you to get sick, but really it's that person-to-person interaction and washing your hands as often and frequently as possible. I also recommend lotion. I know that this can also dry out hands. So if you have a good thing of lotion, keep that close by too. So I wanted to share with you a couple of myths that are going around that are maybe not as supported by research, so that you know and can be better equipped to determine if that's a fact or myth. But also feel free to write in any questions you might have in the chat box too, and Carrie and I can answer those here as well. So one myth that I wanted to address, and hopefully after listening to some of the information that we've shared today, you know that this is a myth, that foods are a significant risk factor for transmitting the SARS-CoV-2 virus. Again, that's the name of the virus that can lead to the COVID-19 disease. And that is not the case. We do not find that there is any increased risk from food or food packaging at this time. Another myth that we wanted to dispel is that delivered foods or foods that you get from the grocery store should be left to sit out for hours before being brought into the house. Please do not leave your food outside for any extended length of time. If it's a few minutes between the delivery and the time that you go to pick it up, that should be okay. But leaving food outside for multiple hours can cause hot foods to no longer be hot or cold foods to no longer be cold, and then you have more of a risk of foodborne illness than actually contracting this virus. So we do want you to put foods in their proper places once they are at your house. Another myth is that I should disinfect food packaging brought into the home. Again, we talked about this. It's something that you can do. It generally is not going to hurt you if you're not consuming that right away, consuming a food after you've used a disinfectant. As Carrie mentioned, we want to make sure that there is no disinfectant on our hands or on any surface that is then touching food that we're eating. But it is something that you can do if you would like to. I know that some people also will remove outer packaging too, and that's again another thing that you can do. It may not actually reduce your risk, but it may make you feel better, and sometimes that's enough right now too. And then takeout food is a significant source of transmitting this virus. And we also, again, know that that is not the case. as food and food packaging is not a large risk factor for this virus. And I've got a couple more here. Again, I should wash my fruits and vegetables in soap, some sort of vinegar or bleach solution. We do not want to do that. We want to just wash our fresh produce with water. Sometimes you can wash fruits and vegetables in a vinegar solution, but that is not known to have any effect on this virus either. And while bleach is a component of many disinfectants, again, we do not want to consume bleach as well. So clean your fruits and vegetables with water only, please. Another myth that has been going around, that sunlight or hot weather might be able to kill this virus. We do not know that to be the case at this time. So again, don't leave your food sitting out in the sun in order to have it be safe, or leave it out in hot weather or cold weather for that matter, to try to inactivate this virus. We don't know that that will work at this time. Again, another myth is that very hot water and antibacterial soap are needed to kill this virus in hand washing. So hand washing best practices, it is a good idea to use warm water, but at this time, it's actually the soap itself that's breaking down the virus. So even if you use lukewarm water or cold water, just wash your hands, and the soap will be the thing that is inactivating the virus. And you want to be sure to wash all of that away in the rinse cycle as well. And antibacterial soap is not necessary for this because it is a virus, and antibacterial soap is for bacteria. So you can use an antibacterial soap, but it will not have any improved benefit for this virus. And then finally, one thing that I hope everyone knows is a myth, but I just want to make sure, is that you should not gargle bleach or any form of alcohol in order to prevent this infection, because that will not work, and in fact, it might make you sick because of doing that. So please do not use that as a method to try to reduce your risk of the illness. And with that, so we wanted to put up our contact information so you can follow up with questions, but now we will open it to see what kinds of questions you have. Feel free to write into the chat box, or I think that we have maybe a small enough group. If you really want to, you can take yourself off mute, and we can try to answer any questions that you might have.
As we're waiting for questions, I was just imagining someone gargling bleach, and that was it wouldn't be on there if someone hadn't tried it, but gosh.
Carrie, it looks like you're talking. I'm not hearing you. Others might be.
Can you hear me?
I can hear you.
I can't.
Okay.
Okay, so we do have one question. Will wearing rubber gloves to the grocery store be beneficial for fighting the, oh good, others could hear you. I apologize, I couldn't hear you there. So will wearing rubber gloves during grocery shopping be beneficial to fighting transmission? That's a really good question. And I think that that has come up for a lot of folks. Carrie, do you wanna address that?
I can take that, Brianna, and if you have any additions, please jump in. Similar to wiping down your food packaging, if it makes you feel better to wear rubber gloves, you can certainly do that. The one thing that experts are suggesting about both face masks and gloves is that if it's giving you a false sense of security, or if it's reducing the amount of times that you wash your hands, or if it's making you follow social distancing guidelines less stringently, then it's not a very good idea. And so certainly you can wear rubber gloves. It's not required. Just as good of a scenario, or perhaps better, would just be frequent hand washing. Again, if you think about just basic food safety, when you wear rubber gloves during food preparation, you would need to change them with every new task that you do. I doubt you're going to change them with every new thing that you touch in the grocery store. So really, once the rubber glove is contaminated, the same as your hand, it becomes kind of a moot point, right? So you can touch everything you need to touch in the store as you're getting it in your cart, and then just disinfect your hands afterwards. Just don't touch your face, right? But whether you're wearing gloves or a bare hand, touching your face is going to have the same impact. So no, you don't have to wear rubber gloves. If it makes you feel better, you can. Brianna, do you have anything to add to that?
No, that's exactly right. That does have the risk that if you're wearing rubber gloves, you still might touch your face, having the exact same undesirable. The other thing that I will say about wearing rubber gloves, and same with face masks, is that it's really important to be sure how you take them off, because you want to not move around the virus, basically. If it might have attached itself to your rubber gloves or to your face mask, and then you take it off and touch your face in the process, or get it on your hands, and as Carrie mentioned, decide not to wash your hands, then you might actually be increasing your risk. So washing hands, again, is the best strategy combating this.
And Jennifer makes a great point. She says that makes a good argument for making certain face masks fit well and not to slide around. That's certainly true. And think about washing your hands before you take your face mask off, and then again after you take your face mask off.
Yeah, so we've got a question here about washing reusable bags when we return from the store. Generally, so we do know that the virus is susceptible to heat at high levels. So when you wash your bags and dry them, as well as anything else like the face masks too, you want to make sure that it's going through a hot cycle, so that the virus is killed. But again, it also has the soap involved, so the soap would inactivate the virus as well. But it is also important to make sure that those reusable items go directly into the washer, as opposed to sitting out and potentially accidentally spreading the virus. And how often should masks be changed? Carrie, do you want to take this one?
Yeah, every use. So if you wear a mask in the grocery store, wash it after each use. You would not want to take it on, take it off, take it on, take it off. Every time you put it on, you need to wash it when you take it off.
Exactly. And Caitlin, I would ask, we can have a few more questions if folks have them, but if you would throw into a poll those questions. We just have a couple of questions we'd love to hear back from you, so that we know if these kinds of learning opportunities are helpful for folks. But again, we can answer some more questions as well while you look at those poll questions.
Let me go ahead and open that poll. All right, so the poll is now open for about 5 minutes, so you can respond to that poll. It gives us a little bit of feedback and also understand where you may be joining us today, and also helps us determine if we want to continue doing these webinars over the noon hour. Every day we seem to have a variety of people come, and we have a variety of topics. So if you also think of a topic that you would like us to cover, please feel free to put that into the chat box. It may not have anything to do with food, and it may just be a topic that one of our extension specialists or faculty members across the state may be willing to offer a program on that. Any other questions are coming in, but I just want to say thank you for those who have joined us today. This is a really valuable topic, so thank you, Carrie and Brianna. I know that our office has been fielding a few of these important topics that you covered, because people just don't know enough about the coronavirus and how, and they obviously don't want to get sick and they don't want to spread that to their loved ones. So this was really helpful, at least for me, to hear some of the information that you shared with us today.
Well, we're happy to be here, and I would say that, you know, in a time when information is always changing, we will be here to try to respond to questions as they come up and share any new information that might come out. but hopefully this has put your mind at a little bit more of ease in terms of the foods that you're eating and how you're getting them. It is important to limit your risk, but at the same time, we still have to eat food. So I hope that you're able to find things in the grocery store, and hopefully that will continue to increase as well. But if you do have any last questions, I'll stick around for a few more minutes here and can answer those too.
Okay, so I'm going to share with you a couple of programs that we have coming up, that especially this next week. So let me get that going for you. So on this Monday, we have Creating Freezer Meals by Katrin Fitch, and she's our MSU Extension Cascade County Extension Agent. Next, we have Principles of Mindfulness by Michelle Grokey. She's our MSU Extension Health and Wellness Specialist, and that's this next Tuesday, April 14th. On Wednesday, we have Spring Clean Your Important Papers, and so that's taught by myself. I'm the county agent in Ravalli County. On Thursday, we have Financial and Healthcare Power of Attorney, taught by Marcia Getting, and she's our MSU Extension Family Economics Specialist. Next Friday, we have a program that has yet to be determined, but it's going to be taught by our 4-H agent in Lewis and Clark County. And then that following Monday, we have Cooking with Kids by Jasmine Carbajal, and she's our extension agent up in Hill County. What's available in your pantry is a cooking class taught by Carrie Krug, and she's a Richland County extension agent. And then Marcia Getting on April 23rd is Legal Ways to Avoid Probate on Your Estate. And so all of these programs are going to be promoted on Facebook. And let me stop sharing. They're going to be promoted on Facebook and also on the MSU Ravalli County Extension Facebook page. And then that's where the recordings and any resources that are ever shared in any of these recordings will be placed there as well. So thank you for coming today, and we appreciate you taking the time to spend a little bit of your lunch hour with us. Have a great day.
Thank you for hosting.